So with no further ado, I'm excited to introduce our next team, PennPUPIL, and I'll have them introduce themselves.
So we are PennPUPIL, the Philadelphia and University Partnership for Integrative Leadership. I'm Elizabeth Tatum. I'm a first-year student at the Fels Institute of Government, and I'll let my other teammates introduce themselves.
I'm Adrian Fang. I'm a first-year MBA student at Wharton School.
Hi, I'm Priyanka Varma. I'm a third-year undergraduate student in the College of Arts and Sciences.
And I'm Allison Book-Arango, and I'm also a Fels student.
Imagine that you are the new principal of a West Philadelphia public school. There are a few hundred students who travel the halls of your school every day, and over 80% of them are considered economically disadvantaged. One of the challenges you've inherited as a principal is a persistent safety and climate problem. There are fights, there is bullying, there's a lack of student engagement. There are also impending staffing cuts. Your core of critical disciplinary, social support, and health staff will need to be reduced drastically next year when funding runs out. And even with these reduced resources, you'll be receiving new students when other West Philadelphia schools close once the round of school closings takes effect. As a principal in this situation, you would not be alone. School violence and poor climate are persistent problems in many Philadelphia public schools, even as resources and student supports diminish or go away entirely. According to the Philadelphia Inquirer, at a June 2012 School Reform Commission meeting, many principals in attendance shared that they, quote, need help with more mental health and behavioral services. Budget cuts hit these areas hard, and that's affected school climate, end quote. This perspective is echoed in the 2012 report from the Mayor's Blue Ribbon Commission on School Safety. But how can schools provide these services when the district is faced with a nearly $1 billion budget deficit over the next 5 years? Through conversations with multiple stakeholders, the PennPUPIL team has developed a long-term, cost-effective plan to support local public schools in their work to care for vulnerable students and improve school climate. We propose a public school University of Pennsylvania partnership to train and coordinate interdisciplinary teams of Penn graduate students to provide mental, behavioral, and physical health care to public school students in West Philadelphia. Each team would represent 3 disciplines: social work, counseling, and nursing. As part of their existing degree and credentialing requirements, the team will complete a 1-year internship together inside a West Philadelphia school building, working together with existing school leadership to improve school climate. While the individual members would change from year to year, the presence of an interdisciplinary team at partner schools would be continuous and long-term. Now, what would this team actually do, and would it make any kind of a difference? We believe that the interdisciplinary team's strength is in its ability to provide preventive care to students, offering support, establishing relationships, and catching problems well before they escalate. School violence is certainly the emergency. It is by far the most pressing and urgent thing, but it's linked to school climate. That's where the problem starts. We want the interdisciplinary team to take on roles that are experience appropriate and put them in a position to provide high quality care to the school students that they interact with. Accordingly, we've developed a continuum of care that consists of 3 levels. The first is, and I'll offer an example of each. So the first is related to program development and climate assessment. The second is about group facilitation and outreach. And then level 1 is about direct care. So level 3 is about training, planning, and climate assessment. One example of a service that the students could provide is they could work together to develop a workshop on a climate-related topic such as childhood trauma and its effects on brain development and behavior. Level 2 is about group facilitation, and this would consist of the team interacting with small groups of students. One of the things that the social worker and counselor could do is work with a group of students using an approach called restorative practice. This is a way to mediate or diffuse interpersonal conflicts, hold students accountable for behavior, increase communication, and build trust and relationships within a group. Level 1, of course, is one-on-one interaction with students. On any given day, this might look like the social worker mediating an interpersonal conflict between students, or the counselor sitting down with a student who feels overwhelmed and out of control, or the nurse practitioner conducting a screening with a student who may be having a health problem. How much time the team devotes to each level of care is dependent on conversations between the partner school and the university. Based on existing internship requirements, the interdisciplinary team would spend 20 hours together at the school each week. The team would be at least 3 people, but it could be larger depending on the school's enrollment numbers and their preferences. We've also thought carefully about how to provide adequate supervision for this team, both inside the school building on a daily basis and through the university. Now, what will it take to make this happen? There are 3 things. First, we need to identify a faculty champion from each of the 3 graduate programs: the School of Nursing, the School of Social Policy and Practice, and the Graduate School of Education. Fortunately, there are faculty within Penn who are interested in this idea, and before we ever approached them, we're already thinking about how Penn can provide substantive mental health and physical health services to schools and within the community. Our idea received good reception from Dr. Terry Littman at the School of Nursing, Dr. Stephen Berkowitz at the Penn Center for Youth and Family Trauma Response and Recovery, and Dr. Carolyn Watts at the Graduate School of Education. There's the potential for PennPUPIL to develop into an interdisciplinary seminar or institute within Penn. Secondly, it will take in-depth conversations with leaders at each West Philadelphia public school to adapt the team's service model to meet that school's unique characteristics. This is a critical part of the equation. A sustainable partnership is only possible if there's mutual respect, parity, and acknowledgement of each institution's assets and expertise, and we've got an insight on how to forge a sustainable partnership from leaders who already have experience in this area, including Dr. Nancy Strime, who worked at Penn for 20 years and was instrumental in founding the Sadie Alexander School. Third, PennPUPIL needs a home, an organization to administer the program and serve as a liaison between the University of Pennsylvania and the individual school buildings. We've had conversations with the Netter Center for Community Partnerships, and they would be the ideal organization for a number of reasons, but for one, they already have relationships with many of the schools on our list. They have voiced their commitment to helping us find a permanent home for pupil within Penn, potentially at the Netter Center itself. We've chosen 5 schools in West Philadelphia for PennPUPIL: William Sayre High School, Overbrook High School, West Philadelphia High School, Dimner-Bieber Middle School, and Henry Leah Elementary School. We selected these schools based on their existing relationship with the Netter Center and their location in our neighborhood. Our ideal pilot would be at Sayre High School because we've had a promising conversation with its new principal, Charles Ireland, and a number of the stakeholders recommended this. They feel that we would have a significant impact there. Now, it's worth mentioning that the school district has seen a number of school safety and climate programs come and go over the years. In response to an incident or a pattern of violence, there will be an infusion of resources which promptly disappear when the money runs out or leadership turns over. Why would PennPUPIL be any different? We believe that this is a long-term solution because of the ongoing needs of the 3 organizations involved. For Penn, every year, consistently, they need to provide internship opportunities for graduate students to demonstrate a substantial contribution to the larger Philadelphia community and to carry forward its academic mission by conducting research and program evaluations. The ongoing needs within the school system to provide safety and a positive climate for high-need, high-poverty populations, support and intervention for vulnerable students, and solutions that are cost-effective and politically saleable. For the Netter Center, they continue to need to extend the impact of their university-assisted public schools and to do so by coordinating existing resources within the university. To bring together these 3 partners, we've established a 9 to 12-month planning process. We recognize that the needs are urgent and immediate, particularly given the matter of school closings, but it's critical that we do not rush this process. We need the time for the 3 schools within Penn to coordinate with one another and to hold discussions with public schools to tailor this program to the school's individual needs. Once fully implemented, PennPUPIL will cost approximately $117,000 per year, That's primarily connected to the hiring of a full-time coordinator. 70% of that funding would come from the graduate programs, and the remaining 30% from private foundations. We've had the opportunity to speak with a number of stakeholders to refine our idea and garner our support, and I'll simply allow you to review those quickly, within the University of Pennsylvania, the school, and the community. We believe that the interdisciplinary health team can make a long-term positive impact on schools by fostering a safe and supportive school climate, identifying health problems early on and referring students for treatment, and mediating conflict well before it escalates. We believe that the time is right to partner with public schools in our neighborhood. Through orchestrating existing resources, PennPUPIL can help public school leaders and staff meet the daily challenge of providing a safe, supportive, and caring environment for all of their students. Thank you. And we're happy to take your questions.
I asked the first question, and I think you did an excellent job, particularly around the issue of stability, because I do agree with you. The general programs that come and start and all of a sudden people 3, 5 years, have you put a time frame on in terms of evaluating to kind of send a message to the community as a whole that this is here to stay?
So we have a couple things. I guess it's sort of a two-tiered question. One is the timeline, and then the second one is how we're going to actually show that we're measuring results.
Exactly.
Okay, so let me jump to the implementation timeline. So this is just for the planning period. There's a lot of different moving parts and things that would have to happen between now and June, the end of June 2014, at which point we would begin piloting in the schools. First, we would start at Sayre the first year, after which we would move to the following 2 high schools, Overbrook and West Philadelphia, during the second year. And then during the final year, we would move to Bieber and Leah Elementary School. As far as assessing, let me move to our outcomes slide really quickly. So these would be the outcomes, but we've actually identified 3 different assessments which we could be able to quantify and measure these outcomes. So the first is a school health index, which is developed by the CDC. And this is a self-assessment which is done by schools, and it's 2-tier. First of all, you have the school identifying physical health as well as school safety. And then the second piece is the school actually developing a plan to then be able to remediate some of those issues that they have. So that's the first assessment we would use. And the second assessment is one actually developed by the Yale Child Study Center. They're actually a model case study, and they've actually done this work for over 40 years now. And so they've developed this assessment called the School Climate Survey, which is sent out to students, to teachers, to parents, and they actually assess things such as like the school facility building, relationships between peers, relationships between students and teachers, etc. And then the third would be actually a Penn developed study which would measure the positive and negative student behavior within the schools. And we would be doing pre and post every year, at which point we would be able to come up with data as far as the level of effectiveness.
Any other model like this in the nation where there is a private university taking this kind of lead?
Yeah, so we did research on a few different options. One was the Yale Child Study Center. They developed the school development program in which they created mental health teams which they sent to 2 New Haven elementary schools. And then this ended up creating a more positive school climate, helped out the students, decreased violent incidences. And after a while, they expanded this program to other schools in Connecticut and eventually across the nation. This started in 1968 and has been ongoing since then. So this is a successful model that we're trying to base our studies off of.
So it's been in existence almost over 30 years.
Yeah.
I would just like to add one thing to Priyanka's comment, and that is that the Child Study Center, its health team was mostly staffed by full-time licensed professionals, and we actually haven't identified a model that uses the expertise and the training of graduate students. I know during the talk I mentioned Dr. Nancy Strime, and it was really interesting timing. When we spoke with her, she said actually she's at Columbia University. She works at she's the VP of their Office of School and Community Partnerships, and she said that they're actually looking towards developing something on this order there, and so she asked us a lot of really great questions just because that's something she's working through.
I noticed in the proposal that you talk about counselors, nurses being sort of the lead facilitator for the teams and the person that will supervise the teams. Those folks are all union employees, and I wonder if you actually met with the PFT and what their response was, because it seems like it might be an additional responsibility of counselors and nurses might have a lot to say about that.
Right. So we actually have reached out to the unions, and however, till today, we have not received anything back from them. So we see this model similar to what like Teach for America or City Year, basically having students who are ununionized and going to the school, but not as a replacement of their jobs. So we do not foresee that there will be an issue regarding the union. However, we're gonna have discussion with them. So.
And I would maybe just add one other piece to that, is that the team, because of existing internship requirements, the team would be present in the school for about 20 hours a week. And the idea is that they're building capacity and they're extending the school's existing resources. And we say upfront in our proposal, and certainly in our pitch to the PFT or even to union building representatives, we would say there's absolutely no replacement for a full-time licensed professional counselor, nurse practitioner, or social worker. There are things that they're able to do because of their licensure that the graduate students cannot do. They're in the schools full-time, all of those things. So this is about expanding capacity, not supplanting or replacing.
In meeting with the schools, a couple of the schools, Overbrook, West Philly, have student success centers. Did you talk to anyone about how you would coordinate a student success center?
So currently, Sarah High School has a health clinic, a success center in place, and I was speaking to Mr. Ilyas Muhammad from the Philadelphia Student Union about this, and basically he voiced his opinion that currently the Sarah High School Health Clinic is mainly focused on building up the community. It works towards helping out adults and families, but isn't as focused on helping out students. And so our goal is to really, by implementing PennPUPIL, to work directly with the students in providing them the mental, physical, and behavioral health support.
I think mine is more about a concept of additional information to you. Raise and identify the problem and the climate and the desperate need across very well. And it's something very near to Dwight and Mark, because we stewards of education, public education. So the need is so great. The funding is decreasing each year. State's funding is decreasing. Other sources of funding are decreasing. That's no excuse, but unfortunately that exists. And it's very frustrating to me that we are not doing a whole lot more for education. At the same time, if we had all the funding that we could have, this still would be an argument. Because that kind of partnership, when you take professionals, and you take academics, and you put them in the schools, and you say, we care, we want to work with you, matters so very much. I was reading today in the New York Times the desperate need to counsel young people about violence. Those who have witnessed violence, those who have been touched by cost control of it, and we are under-evaluating that. So I wonder if you connect this to the problem, the direct problem of, say, gun violence within the city of Philadelphia and within our community.
Yeah. Absolutely. We did a bunch of research seeing the connection between that, and you look at poverty. I mean, there's just compounded issues, right? Lots of different issues which are influencing students, and a lot of them have seen violence or they have experienced violence in their neighborhoods, in their homes. And so this is something that is then, it goes on and it actually does influence them and it affects them in the school environment. So you have to take this holistic approach. You need those nurse practitioners and you need those mental health counselors, and you really, so there's just a whole body of research. You will see our lengthy list of, in the appendices, we did very, very in-depth research which actually shows having these individuals in the school building does make a positive difference. And absolutely, there's so much research out there which demonstrates that. And that's why we're so passionate about this.
Given that you have diminishing public resources that we've all touched on, and then there's also this need for students or recent graduates to develop real-life credentials and have real-life experience, do you think this is a model that could potentially use across other sectors? And if so, it's where are some of those key opportunities that you see?
I can speak to that. So as you noticed, at least for the people in the room who haven't read our full proposal, we talked about implementing this in 5 public schools. And while I think that would be a phenomenal accomplishment and would certainly make an impact, there are many other schools in Philadelphia and in other cities in the nation who need this kind of support. So if we're talking about simply expanding this within Philadelphia, we think that there's a really good opportunity to leverage the relationships of other universities within the city. We spoke with Rita Hodges, who's an assistant director at the Netter Center for Community Partnerships, and one of the coalitions that they work with, it's called FEND, and it's a consortium of 36 colleges and universities, and it's really about community partnerships and sharing best practices. So in our proposal, we talk about piloting this program, fully implementing it, and then having a process where we share best practices with other universities, talk to them about challenges we encountered, how we got buy-in from principals, from the existing school staff, and then hopefully they would adopt this model and then be able to replicate it in Philadelphia. And as I said, in the case of Dr. Strime at Columbia University, with her level of interest, I think if we were able to do this successfully in Philadelphia, other cities could certainly look to Penn and the partner schools to implement it in the future.
One thing I would just add on that is I would recommend that you all check out the State San Francisco's application to the Bloomberg Mayor's Challenge. It's a very similar thinking to what you all have proposed.
Yeah, absolutely. One other thing I was going to add to is the fact that we have proposed this 3-tier system, if you will, but Penn has so many other resources and universities have so many other resources they can actually offer to the schools. So, I mean, we have the dental school goes out and does dental clinics, and the ophthalmologists go out and they provide vision screening. So there's so many other resources. So during this planning period, we're going to go to the schools and say, these are all the things we can provide, and what is it actually that you need? What are the needs of your students? So I think it's really going in and tapping into all of the different options that a university has and providing those to their local community.
Excuse me, I have a question about the fact that it's 1 year team. So, and I went to social work school here at Penn, so I know what it's like to be that social work student and be first and third. It's not a long time, right? We're talking about 9 months, right, at the beginning of the school year, it's looking at this. So I feel there's a consistency to the program. It sounds like every year there's a new team.
So, part of your question was how are those untrained, uncertified students able to actually help the students, especially those violent related. So that's the reason that we choose graduate students, which has not been a focus of the NADA Center so far. And the structure that we created in terms of communication is also 3 tiers. First, they will have a weekly, meeting, and as well as a day-to-day reporting with the specialists existing in the school, including the counselors, including the nurses. And they'll have a report to the in-school supervisor, which is who's likely to be a counselor as well. And on top of that, we'll make sure that they meet their practicum requirement. So they'll have a monthly report at least with the faculty supervisors in their school. Yeah.
And I'll add really briefly to Adrian's comment. That has definitely been a concern that we've heard from faculty members within Penn and other members of the community is you're talking about taking a group of relatively inexperienced practitioners and throwing them in the deep end of the pool. That's what someone said. And so I think that that's part of our model of focusing on school climate and preventive care. And we're also talking about just taking on second-year graduate students. And as part of the 9 to 12-month planning process, we want faculty in the school to come together to say, this interdisciplinary team needs to have 3 to 5 days of training together before they step into the school. And so what are the things that they really need to be sensitive about? What are the things that they need to know? And how can they come under the leadership of the people who are already in the building who have relationships and know students? So we've done, I think we've thought carefully about how to set them up for success, not just the team, but to really care well for students.